Welcome to another episode of the Cosmic Powerhouse, our show, Let's Create a Healing Temple. So today it is all about recovery, but not only recovery after a surgical event. The special thing today is that we learn what we can do to prepare for a surgical event before it happening. For this, I invited today our guest, Heather Campbell. Hello, Heather.
Hi.
Before we go more into your introduction, I would recognize our theme, and that is let's create a healing temple. So we want to have the right energy in the room to make healing possible. That's why I'm opening the sacred room with a shamanic practice, and that's using our Viracocha, our energy bubble around our soul bubble. So if you want to come with me, fold your hands in front and just create that energy bubble around you. It's like the cold aura. And pull it around you and down to your feet. So you're pretty much covered by your own beautiful high energy. And I put it over the room, over the space, so that we are all, also our audience, which is watching this episode, in a sacred space of high vibrational energy. So, and to make sure that we are not too much in the cosmos like you see in my background, we do a grounding breathing session. And that's just 3 times breathing into the earth, just down like growing roots. So are you ready, Heather?
I'm ready.
Cool. So let's do that. Breathe in. And down to the ground. And another one. In and down. And last one. Breathe in and out. Super. So, ready, set, for recover. So, Heather, welcome to our show today. I'm really glad that you will tell us today how a really pretty good recovery process can look like. And that is so much more, not only the rehabilitation we know mostly after the surgery. So you are the co-founder and CEO of Ready, Set, Recover, right?
Correct.
And you're a writer, consultant, speaker, and activist for a long, long time.
Yes.
And I was reading, your leadership is consistently recognized for driving successful bottom line positive outcomes. So, of course, we are super curious to hear today what that means for recovery process. What drove you to really put that passion into that topic? Is it a personal experience? So
absolutely.
Let us hear your story.
Yeah. Yes, I've done a lot of interesting things. I've been in charge of, I was the alchemist. I was the synergist for ESPN. The consistency within all of this, though, was really, my goal was setting people up to succeed. That's what I pay attention to, because if we're all set up to succeed, again, it benefits everyone. It benefits the company. It benefits the individuals. Then I was brought into a situation where I was looking at how could I succeed. I had gone to see a surgeon for something, and they said, I have good news and great news. Good news is the reason you came is fine. It'll just heal. You just hurt yourself. But the great news is you have something really, really wrong with you, actually. And normally it would have been bad, but because you're here, we found it and we can solve it with surgery. And I said, so that's great. And he said, yeah. And so I thought, cool. And I walked out, and then I started to get really nervous. It went from great to silence. And I started filling that silence with negativity. That's a human condition. In situations like that, you get silence, you start to think about the bad things that could happen. And I decided I didn't want that. So I Googled having surgery. What can I do? And Google told me PT, pain meds. And No, no, no. I haven't had surgery yet. I want to do something now to actually get it better. What can I do? Nothing. No answer. So if
No.
Google says there's nothing there, there's nothing there. So I started thinking about, okay, I'm a wellness person. I take care of myself. What could I borrow from other programs that I've done? What could I take? What's going to be specific to this moment in time? What do I need to pay attention to? And I created a little program for myself. And
Wow.
so, yeah, yeah, it was, and it was great. Months later, I'm back in my surgeon's office, and I've had no PT, no pain meds, and he's admiring his work because he's a surgeon. But he also is a really great guy, and he said, "I really wish all of my patients could be like you." And in that moment, I somewhat naively thought, "Okay, I'll create a company. I'll create a program. Everyone should have this kind of support." And so that's what I did.
Wow, what a passionate journey. That's amazing. Out of this situation, that is really real strength.
Yeah,
To just come from that painful situation, from the surgery you own, and then creating out. So it's, yeah, you're a real alchemist.
oh, thank you.
You're
Thank you.
alchemizing pain into purpose,
Yes.
pain into something beautiful. And that is what the world needs right now. And that's why
Yes.
you're also here, because that should be shared. Your
Yes.
message, your example should be really inspire others. So thank you so much that you're
Of
telling us
course.
about that today.
Of
So,
course.
and how went it further? You said you really experienced when you were looking on the internet, what can you do to prepare for such a surgical intervention? And you said, yeah, you did only found the usual things, but not
Yeah.
something which really helps your mindset. So it's
Right.
so much more. It's healing beyond the
Right.
physical, right? It's not
Correct.
about to repairing the body, actually. So it's so much more. So tell me,
Yeah.
what did you find then?
Yeah.
What helped you?
So it's interesting. After doing all of this and really diving deeper, I firmly believe, I know surgery starts the minute you hear the words you need surgery. That's when surgery starts. That's when you start making decisions that are either going to help you or hurt you around this event.
So I
Uh,
want to repeat that
yeah.
surgery starts when you hear surgery. Wow,
Yes.
that's
Yeah.
a pretty good message to
Yeah.
rethink.
I was just talking with someone earlier this week. I have no sense of time anymore. If it didn't happen in the last 10 minutes, I don't know when it happened, but I believe it was earlier this week, talking with a researcher. And she was talking about how when women hear breast cancer, you have breast cancer, hearing those words changes the inflammation in their body. They have shown through science that hearing that, just being told those words, chemically changes the makeup of the inflammation in their body.
My
We
God, that powerful then, right?
so so powerful. And again, I say these things not to freak us out, like, oh my gosh,
Yeah,
one more thing,
yeah, yeah.
but to recognize,
Yeah,
okay, this is our reality. Um, again, back to the situation, the moment.
yeah.
Um, surgery feels like everything's out of your control. There's going to be this whole moment. This person is going to come in. They're going to cut. It's literally the definition of trauma. It's so easy to throw your hands up and say, well, I can't do anything around
Mhm.
this. What we do at Ready, Set, Recover is we help you look at actually, hi, there's so much you're already doing. Are
Mhm.
you doing it in a way that helps you? So one of the first steps we have in the program is the story of your surgery. When you have to have surgery, you tell people. Sometimes you tell them because they're logistical reasons. You need to tell your boss why you're not going to be at work. You need to tell your partner what's going on. Number one, when you tell this story, you hear it. You hear it over and over and over again. What story are you hearing? When I had to have surgery, I said same story over and over again. Good news, great news, having surgery. Good news, great news, having surgery. Could have said, I have a bone eating lesion. A third of the bone is gone. It could shatter at any time and it could be cancer. Both of those stories are completely true. Both of those stories are what my surgeon told me. Number one, which one do I want to hear? I do not want to hear bone-eating lesion, cancer, shatter. I don't want to hear those words 100 times. I don't want to hear them twice. I want to hear good news, great news. So do I want to be creating cortisol or dopamine? What do I want to do? Because I'm doing that. That's me. So number one, what am I doing to myself? Number two, what am I going to elicit from you? Am I going to give you a story that makes you shake your head and smile, just as you did? Good news, great news. Oh, okay. Or am I going to give you a story that makes you horror? Oh my gosh, no. That's what do I want? What loops do I want to be creating?
The
Those are
power of
things
words, right? The power
completely
of words, completely
positive.
underestimated.
Yes, positive narrative. Well, and think about going to a movie. You go to a horror film, what happens in your body? Is your body relaxed? No, you're
Could
gripping.
be, no.
The popcorn
Well,
is
after some
flying.
time, if you watch that every day, maybe there's some
Right,
change, but you're
right.
right. Yeah. It
Mhm.
has an impact. And that's what we
Correct,
want to tell the people, right? That
correct,
energy and nothing else is words, communication, words.
correct.
It's really bringing energy out, frequencies, and so important in our
Correct.
daily business, and especially in the healthcare environment where we want to
Yes,
heal people. We want
yes,
to support them for healing. So,
correct.
yeah, so powerful what you share and so important
Thank you.
because I don't, well, I'm 35 years now in healthcare and I cannot remember that ever there was someone speaking about that when I was a
Right,
patient in hospital or when I'm was there as a healthcare expert, right?
right,
Having conversations. So
right.
it's why is it so? Why do we not speak about that? So do you have an idea?
I actually do. So as I do this work, I have a lot of conversations with many people, and very often, people don't talk that kindly about their surgeons. They they talk about them like, they didn't do this and they didn't care about me. And so I've come at it from a different perspective. I come at it from a perspective of if I were to say to you, I have a bone eating lesion, third thing, third gone, could be cancer. You, most likely, layperson, are not going to say, oh, come here. Let me cut your body open, move some stuff around, put the crushed up bones of a cadaver in there, sew you back up, and it'll all be okay. That's really weird.
Yes.
It's weird. Like, that's wacko that you think you can cut me open, move a bunch of stuff. So I am willing to say, okay, surgeon, medical team, you go be laser focused on it. That sounds really hard to me. So you dehumanize me so that you can do it. You go do all of those things. You pay attention to my heart rate. You pay attention to the anesthesia. You go do all of those things that I don't even understand. But the rest of us have to recognize there's more that's going to go into this to benefit us. So couldn't we come in partnership? And I know medical team, you're already stretched. You don't have time. Like you there, the average surgeon talks to a patient for 13 minutes about the surgery. 13
And that is
minutes.
in overall
Um, in the initial appointment.
in the initial one.
Um, and
For
and
very often a really life-changing thing.
correct. And think about all of the things that they have to cover. Again, the medical side is really, really complicated,
Yeah,
and you need to get through that. So again, giving grace. I'm going to give grace to that
absolutely.
side. And I'm going to raise my hand and say, hi, team human beings. Don't you think the rest of us should look at that and say, so if I don't want cortisol coursing through my body, if I want to add dopamine, if I want to create community, if I want to take advantage, I'm greedy. I want to take advantage of any easy, positive energy I can. Stepping outside and feeling the sun on my face, we know that it's beneficial. We know that, again, it changes what's going on with our chemical makeup. Use it. Use everything you can to give yourself the bump up.
So it's interesting what you're saying. So coming to the question, what would be the overall vision from your side for a healthier world, to just have the
Mm,
big context, what you're thinking about that?
yeah. Yeah. Um, so it is I love, just as you did in the very beginning of this, an invitation. You invited us to ground. You invited us to take a breath, to take a moment, to sit in, to be aware. Um, I hope that healthcare starts to invite people in to do those very things, to truly start moving from hurt care. We have a hurt care system. That's what the system is that we have. You're hurt, we can fix it. We can monetize it, we can fix it. We can see results, we can fix it. I want us to move to an invitation of a health care system. How do we proactively do things to benefit you? When you are in a moment of trauma, how do we look at the totality of what we can do? How do we welcome in? Okay, yes, my Western medicine has had one lecture on nutrition because there's so many other things that they need to have has had one lecture on the mind body connection in their however many years of med school. Can you open yourself up to say, I might not be the expert on that, but I'm going to welcome those ideas. I might not, I'm the expert on so many things. And that's what we're doing at Ready, Set, Recover. We're really saying we want to partner. We want to complement. It doesn't have to be either or. I love the word and.
Yes,
And
me
is
too.
my favorite word.
Bridge building, and not
Yes,
really having that silos. It's only the
correct.
spiritual side and it's only the Western medicine. It's,
Right.
yeah, there's such a big opportunity, especially in
Correct.
these times now where we have huge transformation on the whole planet, the whole world.
Yes.
So we have it in our hands, what we
Yes.
create, what how future healthcare really looks like,
Yes.
especially with all the challenges we have right now. We have
Yes.
solutions, and that's what we're talking right now.
Right. Right.
So, yeah, beyond surgery and more looking into the holistic recovery, coming back to the specific process and
Hmm.
your services you're offering. So how does
Hmm.
it look like? So when a patient comes to you, so what is
Hmm.
the journey for the patient?
Yeah. So ideally, they come to us before surgery, 16 days actually. So way before surgery. We want to be helping you prep and get ready. It's both holistic and logistic. So there are things in there where you're talking about, like I said, your positive narrative. You're also looking at your surgery day game plan, recognizing that just as if you were going on a big trip, if you were going on a big, wonderful trip that you were excited about, you would say, oh, what's the weather going to be like? What do I want to wear? What clothes are going to make me feel beautiful? How am I going to shine when I'm there? Oh, what restaurants do I want to go to? Where do I want to eat? What events do I want to see? Oh, I need my passport. Oh, I need this. Oh, I need that. You would actually take time to think it through. One of our action steps is a surgery day game plan. Same kind of thing. How do you actually take the time and attention that you need? Another part of our program is all online. You can do it through your phone, through your computer. We've listened to our customers and they've said, sometimes I want to type, sometimes I want a bigger screen. So that's how you can access it. While it is online and you get to decide, oh, I want to take 5 minutes for this today. I want to take 30 minutes for this today. Oh, I want to go back to it. All up to you. We also recognize, though, that having community is so important. So within the program, number one, we validate that it's okay to ask for help. A lot of us, it's really hard for us to ask for help. We don't want to do that. One of the things we talk to people about is when you help someone, if I were to help you, a chemical is released around your heart. It is beneficial to you to do that. So when you ask for help and let someone help you, you are actually helping their health. So
Wow.
think of it not in a selfish way, think of it in a beneficial way. You are actually doing something nice for someone when you
Wow, that
let
is
them help
so
you. Yep. So number one, we're validating it. Number two, we're saying, and it's actually your responsibility right now to set yourself up to succeed. So if your doctor has said you need to be off your feet for 2 weeks and you have a dog, guess what? You got to find somebody to walk that dog. We're going to help you do that if you'd like. We've got an entire part of the program that rallies surgery supporters around you. You get to tell us friends, families, colleagues, people in your life that you want to be a part of this communication. And as part of it, you can actually ask them to help you with things to do. We actually curate that. So again, it's holistic and logistical things that are going to happen pre and post surgery so that you can be taking control of things that you can be taking control of.
That is really a very holistic approach.
Yeah.
And actually, I know that situation. I was facing an arthroscopy for my knees. I'm living alone. So I was asking the orthopedics, so how does it look like? Yeah. How can I handle this?
Yeah.
I'm living in an ancient building, so I don't have the elevator. So how can I handle this? Simple things, practical things. And it really, well, it was pushing me to heal myself, which I was able to in my special conditions. But for many people, it is really a big issue, and they don't know how to solve this issue. They don't have maybe the family living around, right? And it is fantastic that you're including that kind of service. It's just a practical thing sometimes, which is a huge thing you have in your mind and is actually already causing this negative thinking or worries. So how would you actually be able to solve this, right?
Yeah. It's interesting, again, I had a nurse go through the program. So a nurse went through the program and offered me feedback and started by saying, I'm a nurse. And I thought, oh my God, you're a nurse. I'm really scared of the feedback you're going to give me because you're a medical professional. And I said, okay, so did you know everything in our program? And she said, yeah, I did. I knew everything that was in your program. And I said, okay, how do we do? Like, did we have the right elements? Did we talk about it in the right way? And she said, perfect. Excellent elements, all the right things, no jargon, communicated in a way that you could understand whether you had any medical knowledge. I didn't feel talked down to. And if you had no medical knowledge, perfect, great.
Wow,
I said, well,
that's
thank
wonderful.
you. Amazing. Like validate, yeah, yes. And then I said, do you want your money back? Did I waste your time? Because you knew everything. And she said, oh, no. I knew everything. I wouldn't have done any of it without your program.
Okay.
Without the framework of someone knocking on your inbox and saying, hi, so sleep's important. We're going to ask you to track it. We're going to ask you to get real information, not just be like, oh yeah, sleep's important. Think of all of the things that we know as adult human beings. Like, oh, I should be sleeping. Oh, I could be meditating. Oh, I should drink water. Oh, like, yeah. With our program, you're actually checking in, writing it down, following up. And in doing that, this woman said, I recognize that I never sleep enough. I'm sleeping 4 to 5 hours a night. I had no idea that it was that little until I had to track, until you had me say, what time did you go to bed? What time did you wake up? Looking at it, seeing it in black and white is completely different. There's accountability, there's reality, there's actually gathering data information, and all of those things can change outcomes.
Yeah. And we see in the world right now, and the people are challenged by overwhelm, distractions, ongoing. So I think it's human, right? That we know things, but we are not following up everything what we know. It would be great, but
right.
myself the same.
Right. Well, right.
So if you only know and you don't do it, so it's also like not know it. So it makes no sense, right? And we can see what kind of huge impact it has, what you're doing, right? With the check-ins.
Right. So I, again, like you and I know each other a little bit. I don't know everything, but I'm assuming you meditate, right? And that you've read all of the data on meditation, and you've probably been in some moments that are absolutely mind-blowing.
Yes.
Me too. Like I have read the data. I have meditated with Thich Nhat Hanh. I have meditated with Deepak Chopra. Like I have had the moments. None of that matters unless I meditate every day.
Yeah.
Doesn't matter. Like, oh, great. So I had all those wonderful experiences. Wow. I have to meditate every day to get the benefits of meditation. again, the beauty of Ready, Set, Recover is I'm not telling you you're going to have to change your life. I hope you do. I hope you add these things in. But I'm just saying right now, in this moment, 24 days, for 24 days, I want you to pay attention to you've got this big thing happening. It's going to happen. It's going to take time and attention. If you don't give it the time and attention it deserves, it will take more. So that's, I kind of think in some ways, again, here's this silver lining in this moment. We are introducing, reinforcing, welcoming, inviting you to pay attention to things that you can within your life. So you're setting yourself up to succeed.
Yeah. So it's really mind shifting, right? What you're doing. It's amazing work, really.
Thank you.
Really amazing work.
Thank you.
I heard before from you already, but now I'm even more impressed by what you're doing. It has such an impact. So yeah, patient empowerment. So you already were talking about that. How can you shift your mindset with the check-ins, really going into consistency, into routines? So what else can a patient do for supporting self-healing in your process?
I think it depends on the person, honestly. I'm kind of offering you this huge buffet, huge buffet. Within it, what speaks to you? What resonates to you? There's movement. We think of these things, sometimes people always go to the extreme, depending on what's going on in your body, what's going on with your surgery. There is some movement you can do, even if it's just the movement of your breath. So within the guidelines of what your doctor has said, within the guidelines, both from a physical and a timing perspective, what would you like to commit to? How are you going to commit to that? Gratitude. One of the action steps is 4 things I'm thankful for. Again, we know that this changes the brain process. We know that this changes the body. It isn't the type of thing that similar to meditation. If you did it 3 weeks ago, it doesn't stick around. It's actually very funny. I remember talking to my mom about some of these types of things, and my mom is amazing. Kudos to my mother. My mother is an amazing, incredible person. Period. End stop. And my mom wants things done. I once asked her, there was something going on in her body, and I said, would you go to a chiropractor? She said, no, I want it fixed. Chiropractors don't fix it. I said, okay. And then I looked at her hands, which were gorgeous. And I said, your nails look beautiful. My mom has, goes and she said, oh, thank you. And I just got them done. And I said, they're gorgeous. So you don't have to go back to the nail salon, right? Like you got them done. They were fixed. Life won't chip away. They won't grow and change. And you won't need to go back in it. And she said, Heather Ann. And I said, what? Why will you go and take care of your nails, but you won't take care of your body? You won't take care of your mind. So many of these things, you need to come back to them. So for I'm thankful for, we ask during the program and then offer for really forever. Can you find a time in your day where you can write down, not just think? Again, there's a different process when you are taking the time. Write down 4 things. Can be small. I do it at night every night. What I find fascinating is there are some nights I sit down and it's been a hard day. Life, within all of these things, again, you are on a beautiful path. It's still hard. You can do, it's still hard. So on the nights that I've had a bad day, because I have bad days, and sometimes I sit down and I think, ugh, 4 I'm thankful for, really? Okay, all right, what do I got? And by the time I've written down the 14th thing, because now I'm on a roll and I can find it, I think, okay, stop. I get it. You're grateful. Go to bed. There are things in our life that if we can give it the time and space to pay attention to, will set us up to succeed. Sometimes it's just hard to find them.
That is so true. So, talking about gratefulness, are you also remembering your patients and clients to do that during the stay in the hospital? So, because I can imagine if they are
Yeah.
doing that during their stay and also
Yeah.
reflecting how many people, healthcare professionals would actually be good to them, yeah,
Yeah.
and
Yeah.
having that nice moments as well, not only the painful moments, right,
Yeah.
or criticizing something.
Yeah.
It should actually change something also in the connection to the healthcare professions, right?
Correct. Correct. So my daughter had to have surgery. She's absolutely fine, but she had to have surgery. So we're in the pre-op and, they're all buzzing around and doing stuff. And one of the nurses stops and looks at me and says, Mom, I have to tell you, you've been great. And I said, thank you. And she said, no, you and your daughter, like you've been amazing. My daughter's sitting there doing breath work as the IV goes in. She is repeating her surgery saying, mantra. Um, and so the nurse says this to me, and I said, well, I do have a company that helps people get ready for and recover from surgery in a better way. And every nurse in the room stops and swivels and looks at me and says, what? And I said, yeah, it's things like you're seeing. It's teaching the person to do breath work. It's having them say a surgery saying that's positive. If they're comfortable, they can even offer it to the people who are prepping them, saying, like, this is what I'm going to be saying. Would love it if you say this too. You could see the weight I had lifted off their shoulders because here's this kid who's not freaking out. And here's this support person who is truly supporting. And they all looked and they said, "Oh my God, that's amazing." And I said, "Thank you." The funny part of the story is my daughter then looked at me and said, "Oh my God, did you already said recovered?" And I said, "Yeah." And she's like, "You did. You totally did." I said, "Right. I totally did." She's like, "Oh my gosh." And then, because she's also a little entrepreneur, she says, "Do you think you should pay me being the first child to go through the program?" And I said, "No." She's like, "Focus group. I'm a focus group." I said, "No, I think you should pay me, as a matter of fact, for going through the program." But the point of it really is the making less stressed, more compliant patients absolutely 100% helps the medical professionals as well. It's creating shorter hospital stays, less reliance on pain meds, higher patient satisfaction, because when you have someone who is entering in already feeling in control, in power, ready to partner with you, it changes outcomes, it changes the experience.
Absolutely. So can only mentioning the double slit experiment, which is very old, but we know that it
Yes.
has an impact if we are observing something, yeah, our thoughts. So there's a lot of theory around it. I don't want to go deeper into that now, but we know that it actually changed the outcome when we are
Right.
observing something, when we are having a different kind of mindset. And like you say, partnering, really to see we are in a partnership.
Yeah.
Yeah, I'm
Correct.
here, I have some issue, you are helping me. And yeah,
Yeah.
and that really changes something.
Yeah.
And what I experienced over the long time, but especially now also with that outside noise, of course, and the challenges, is there's so much fear in the healthcare system, and so much
Yeah.
challenge and pressure and worries for many reasons we know. But yeah, it's really to find the right approaches
Yeah.
to reduce that fear, and breathing and seeing
Yeah.
our collaborative approach
Yeah.
is for sure, it's really a step forward.
Right. There is the biggest tool we have in surgery that is not used is the patient. We have this
Very good said.
amazing, incredible tool that we could be using in surgery, and we don't.
Yeah, it's in surgery, or I had a conversation also about rare disease. So it's in
Yes,
many
it's
areas
it's in
where we
all
where we
healthcare.
forget, yeah, we forget that the
Yes.
patient itself she knows how it feels, what it really feels, and can give every healthcare professional good insights and good hints where to look at and so on. And not every patient is able also to articulate that. So it's really, it's very important that as a healthcare professional, we also give them the chance to speak out what they, so to really be conscious, to recognize from the present moment. And for this is breathing excellent and grounding, and really to give the chance also with the speech, with the right words and intro, to make the way free, that this information can flow and we help each other. That's more or less right.
The first day of our action program is called Your Advocate, being your best advocate. And it, again, is helping you think through, what questions do you want to ask? How do you ask them? How do you make sure you understand the answers? Very often when you're going in for surgery or you're going in for a health experience, they'll talk about the complications, things that are going to be bad potentially. Very often they don't talk about the normals, things that could normally happen during this, which will be normal for them in terms of outcomes, but are not normal for you. So when those things happen and you get, again, every time you have that doubt, that fear, that questioning pop into your head, we know it's not beneficial for recovery. It's not beneficial for creating the best landscape for the surgery to happen. So any places we can, again, it's like creating these little cheats. How do we just set it up in the best way? Having people think through not only what do they want to ask, but how are they going to ask it and how are they going to receive it? I think of myself, I raise my hand that I am not always the perfect follower of everything. I've been in the situation in the doctor's office where they're, blah, 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 blah. And in the very beginning, they say a word and I don't know the word. And I'm trying to figure out how you spell the word. And how do you think you spell the word? And should I ask how you spelled the word? And am I stupid for not knowing how to spell the word? And they are now down 5 different paths. I have missed the last 5 minutes of conversation because I can't figure out how to spell some stupid word. We talk about things like, number 1, tape it so that you have the conversation. Number 2, don't be afraid to stop and say, so sorry, need to take a pause. I'm writing these things down. Didn't get what you just said. Again, this is not the time for you to make everyone else happy and okay. This is the time for you to make yourself happy and okay. Along those same lines, we talk about the responses you will get on surgeries. You're telling your surgery story, someone starts talking back to you about it. I had the situation. I had, again, had this surgery. I'm standing with a cast. My hand is like this. I'm on 6th Avenue in New York City. I've got my hand up in a cast. I've got a stroller in the other hand. And some guy, never seen him before, walks up and says, oh, rotator cuff, had it, was awful, blood, and starts talking. Okay, number 1, I didn't have a rotator cuff surgery. I don't know this guy. And he's just talking. And it was awful. It was, and I stopped him, said, excuse me, are you okay now? And he said, yeah, but, and I said, that's so great to hear. Thank you so much. And I turned away. I don't need to listen to this. It's not helpful. I have a job right now. My job is surgery and recovery. And I need to pay attention to that job. I need to do it in a way that I'm comfortable with, but I need to do that job.
Yeah, that is so true. Yeah, and what is also completely underestimated is what we take in, right?
Correct.
As a being, right?
Correct.
So it is all the outside noise, all the outside, all what we're listening, even songs, lyrics, everything we are taking in, and it's changing our minds and it's working on us in the unconsciousness. So it is really very impactful, where we really need to be careful where we put our focus, because there the energy flows and it's working there. So we were talking about the situation more in the hospital. So what about the long-term perspective? So I can imagine when you do such a process and you're preparing perfectly for the surgical intervention, you go through that and you have some after program. So what is your experience with your cases? So after the surgery, so what is the impact then on the long term? And how often do you see that patients are really be able to implement those different kind of routines in their life so they can really, the good result of the surgery?
It's interesting. In terms of responses from people, I'm overwhelmed. I remember actually getting the first email from someone and being afraid to open it. Like, oh my gosh, I hope it. And the person said, I've had surgery before. This was completely different. This changed my life. So what we are seeing from people, again, both from a patient and a hospital administrator, surgeon, ambulatory service, surgery center, we are seeing the results you'd want: higher patient satisfaction, less reliance on pain meds, shorter hospital stays, fewer complications. We had another nurse. I don't know. I love nurses. Nurses are my favorite people. Sorry, everyone else in healthcare, but nurses really are just my favorites. Another nurse went through and was giving us feedback and said that his surgeon was enamored with himself because the recovery went so much better. And oh my gosh, like the surgery must have been amazing because your recovery is just stellar. And the nurse said, no, wasn't you. It was Ready, Set, Recover. Just to be clear. I was like, oh, wow. I don't know that surgeon's going to want to work with me, but thank you. So we're seeing
actually,
those.
Yes, because that is such a benefit, no?
Correct. But what we're also seeing, it was interesting. We had someone go through the program and their feedback was, so great. Thank you. I was sad when it was done. They said, when it was done, you weren't in my inbox anymore. Like you had been coming to me and saying, you got this. And they said, I have a wonderful, incredible, supportive family, but my family was, the minute I came home from the hospital, surgery was over. Like, again, the Western medicine, surgery starts midnight before surgery, don't eat, don't drink. When you get home, you're done. Nope. Starts when you hear the words, goes until your body and your mind have recovered. So this person was saying, again, loving, wonderful family, but they thought surgery was over and it wasn't. You kept me going, positivity, focus on things that I could do, wonderful. But then the program was over and I wanted more. So from that, we started Healthy Habits. And Healthy Habits is a continuation that people can do that. Again, it's that check-in, it's that dopamine hit of, oh yeah, they're going to be asking me again this morning when I slept. Maybe I should go to bed now because I like getting that dopamine hit of, good job, you've paid attention. So we are seeing people continue it. It's actually another funny story. My sister had to have surgery and contacted me to, number one, let me know, and number two, say, and I'm not going to do Ready, Set, Recover. I was like, hi, sis, who loves me. What are you talking about? You're not. And she said, you can't fool me. It's not just about surgery, is it? It's about how you're supposed to live your life. And I said, totally. It's totally. And again, not how you should, how you could. I said, I'm not going to make you change everything in your day to day. I'm going to ask you to pay attention to this time around surgery, because again, it will take time and attention. If you don't give it the time and attention it deserves, it will take more. So can you commit to doing just this time, this time? And then if you want to continue, if there are things in here that resonate with you and speak to you, great. Take them on, enjoy them, use them. So that's what we're seeing.
Okay, wonderful. So when I hear you saying all these great benefits and outcomes, surgeons and also insurance must be, great fans of your program. So what is the reality looking like?
The reality is harder than that. So yes, we have heads nodding. Everyone says, of course. back to the system we have. The system is a scared system. The system is a complicated system. The system is a giant hairball. That's what we've got in healthcare. So where I'm at the moment is proving to those systems that there is a benefit in language that they can understand. So we're currently doing 4 pilots. I'm greedy. I want more. I will pilot with any hospital system, surgery center, practitioner who recognizes, oh, yes, let's see, doing this program would actually benefit my patients and benefit me. Yes. So we are doing those things now so that we can get the data to prove what we've already seen and have that checkbox. Because again, people need the validation to go to their boss to make the case and then to actually pay me. Because while right now the program is being paid by patients, ultimately those aren't my customers, they're my participants. My customers are the healthcare professionals and the insurance company, because this is affecting their bottom line. I believe they want to help their patients. I do. I believe everyone wants to help. I recognize that they ultimately are a dollar-driven organization. I can help those dollars. And in doing so, they should be paying me.
Yeah, because actually it's benefiting them so
Correct.
much.
Correct.
And yeah, so it would be fair to say, at least to share in the
Correct.
first step maybe, but yeah, to take this over. So are you actually right now looking for more centers to
Absolutely.
get so
Absolutely.
then
yes, anyone out there, readysetrecover.com, go to
tell
our
the
website.
audience.
Yes, readysetrecover.com, just as it sounds. You can contact us through that. And we are actively inviting pilots. And within that, it's interesting. I was just talking to an administrator, and they said, so if we piloted with you, what would what data would you drive? And I said, what's your pain point? You tell me. I had one administrator look through the program, and they, look at this, look at that. And they said, oh my God, go to surgery day game plan. And so we did. And I walked them through the program, walked them through that action step. And at the end, there's a PDF for the participant that they can print out for themselves, send to their surgery supporter, actually send to their doc, all this stuff. And the administrator looked at me and said, okay, I believe all of it. I believe the mind-body connection. I believe the stress reduction. I believe all of it. If the only thing your program did was get people here on time, it's worth it for me to pay for this. So within the data, within the piloting, I say to the systems, you tell me where your pain points are. Let's go put some patients through the program, gather the data, and see what we find.
They really must love it.
So yeah, so we're getting a lot of positive responses. But as I said, I'm greedy.
Yeah.
And I want people to have this support. So it's not just, this is a business. I've created this business. I want this business to drive revenue, all of it, drive benefit for the systems, all of it. People should have this.
It's a passion, right?
People should just have this support. They deserve this support. We as a people should be recognizing, again, Western medicine got it. It's horribly complicated. You need to focus. Terrific. Everyone should be able to have this support, and knowing that the way it benefits everyone is gravy.
I so agree. So please listen,
Yes.
healthcare leaders outside, and
Yes.
all others responsible, right? It's also
Yes.
about politics. It's about the
Yes.
framework, how we work together. So it's
Yes.
all about collaboration. And
Yes.
this time, the time has changed. So now
Yes.
it's time for collaboration.
Yes. Well, within that, in terms of community and collaboration, I will also say, in terms of people listening out there, if you are someone who is having surgery and you need our program, and or if you have a loved one or someone in your family who or friends and someone you know who you think would benefit from this, and you want to buy it as a gift, we welcome you to do so on readysetrecover.com. And because you're listening to this and you're hearing about this, I'd like to also offer you a 20% discount on that.
Oh, wow.
Just include a code FRIENDS, just one word all together, Friends of Heather, when you check out, and you will get a 20% discount. I believe in community, and I believe we should all be there for each other.
Wonderful. Thank you so much,
Of
Heather. You're
course.
offering that. So we will deliver that also with a podcast recording. You will find it in the resources.
Wonderful.
So speaking about collaboration, what specific partnerships are you looking for to support that?
Yeah. So hospitals and ambulatory surgery centers are really where we've been focusing. Organizations that have the mindset of clinical care, like they are focused on clinical care, but recognize that there are more things that they can be doing within it. We're piloting right now everything from a randomized controlled IRB, if you're in research, kind of the full shebang, the big, to doctors saying, okay, can we put a couple people through it for free? And I say yes. So it's really all, the full range. I was actually just at Becker's conference, Ambulatory Surgery Center conference in Chicago a week ago or 2 weeks ago. Wonderful talking to so many people there about what they're doing and how they are looking for innovation, recognizing that they need to be giving their patients not only wonderful clinical service, but more. How can they add on and do that something special? So it's looking for clinical partners who recognize that from the patient experience, from a business perspective, that's important. And then from a actual outcome, engagement is so important. So I'm looking for partners who are not in their heads and saying, yes, I want that, but also I don't need to recreate the wheel. Like, back to my Googling, what's out there? I kind of feel like I'm raising my hands like, hi, we're out here.
I'm here.
Come, we're right here. You don't need to reinvent the wheel. You don't need to put all that we have into both the technology, the user experience side, which is really difficult to create. That's one of the things where, again, I kindly want to say to healthcare professionals, we've created these portals, patient portals. We've got all of this integration. It's not user friendly. It's not joyous to do. I mean, I was on my user portal for something the other day and wanted to just hit my head against the wall in terms of I'm just trying to get this thing. We've taken a lot of energy and effort to make it a wonderful, transformative hug of an experience during this trauma time. So medical professionals who don't want to recreate the wheel, who recognize there's a benefit, we're your partner. We're right here.
That's amazing. So yeah, that's why we created this show, right? So let's create a healing temple is really made for this, to showcase these solutions which are already existing in the world in different countries, and to bring it closer to the healthcare leaders to decide on new ways to really create a better future healthcare.
Right.
So
on that note, I'll add real quick. So 2 of our pilots are actually international. One of our pilots in Israel and the Czech Republic. Yes.
Okay.
So again, within this, the beauty of this is we're in a whole new world in terms of what you can do on the tech side.
Absolutely.
So wherever you are in the world, we can be a partner.
That is, I think, very important to say, because you're in Massachusetts.
Yes, I'm in Western Mass.
Yeah, so you're in the US when we say US market.
Yep.
But yeah, as it is an online platform and online services, it can be used by all countries, let's say.
Yep.
Okay, fantastic. So wonderful to hear about your wonderful preparation and after service process. Let's have 3 closing questions. So
sure.
Yeah, what is your call for change shortly?
What is my call for change?
What shall happen?
Yeah. Recognizing that things are invitations and taking a breath to see if we can say yes to the invitation. That's my call. Okay. How do we stop the judgment, the initial fear, the initial again, that judgment of if someone's inviting you, or if they're saying, I don't have enough, or they say, no, 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 it's an invitation. More. And, you know, back to our see the and. Say yes to the and.
Okay. And yeah, I experience you as very passionate leader, a lot of energy. How are you doing that? So how do you
Oh,
use for yourself the
yeah.
techniques that you
Yeah.
really have this energy to do that great business?
Oh, thank you. Thank you for part of it is doing things like this where I get to talk about it. It feeds me. Meeting wonderful people like you who see it and say like, oh,
Thank you.
so this is great. And I say, yeah, thanks. This is great. And then you say, oh, let's talk about how great it is. Like these types of things. Um, Again, back to life is hard. There's some hard things. I work really hard at this. I wake up every morning an hour before the rest of my family, which means I get up at 5:30. I scrape my tongue, I drink hot lemon water, I move my body a little, I spend 20 minutes meditating. I stretch my hand, which I've got a little wrist thing going on. And then I'm ready to welcome the world because I have taken that time to ground myself. Um, I try to eat good food. It doesn't always happen. I start my day though with my compost smoothie, which is basically usually a base of spinach, protein powder, and then whatever's about to go bad, or you know, the tops of the strawberries that I cut off the kids' strawberries. I recognize that everything I put in, and in affects me. Do I always make decisions that are holistic and beautiful? And nope, I don't. Do I recognize that if I'm on a cycle of that, maybe I need to stop? Yep, I do. Um, Mostly though, it's with people. I actively find people who support me. I let them support me. I reach out. I have a rule that if I know you and I've thought about you 3 times, or if I don't know you and I've heard about you in interesting ways 3 times, I have to reach out. Have to reach out 3 times. If I heard about you 3 times, got to reach out. Um, and that brings me joy. So I am taking energy to find the ways that feed me and give me joy and recognize that sometimes it doesn't happen, but it's okay. Tomorrow's another day. Can find more ways.
Great example. Great example. So, yeah. And finally, talking about legacy. So, how do you want to have your great work and contributions to be remembered?
Yeah. It's funny, again, thinking about all of the different ways we can communicate right now. I'm on LinkedIn. I've got and I try to communicate a lot during LinkedIn. And at different points, I've played with my LinkedIn profile. You know, Heather Campbell is blah, 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 blah. Heather Campbell has done X, Y, Z. Where I've landed is I know my purpose in life. My purpose in life is to make people feel seen, heard, and celebrated. That's what I want. That's what we're doing in Ready, Set, Recover. We are making people feel seen, heard, and celebrated. We are recognizing that they can do that through action. If if everyone in the world had their foundational needs and a little bit more financially covered and felt seen, heard, and celebrated, the world is completely different. So I'm not going to most likely meet every person in the world because that's crazy. But the people I do, if I can, I'm looking to make you feel seen, heard, and celebrated because I know that when that happens, when you are set up to succeed, it's just going to be a beautiful, beautiful tidal wave of positivity, of possibility. That's what I'm hoping to do.
What great closing words. So, thank you so much, Heather Campbell, for being here in the Let's Create a Healing Temple show. I think we could really feel that high vibrational and passionate energy. And thank you so much for telling us about your business, Ready, Set, Recover. It was great pleasure and very enlightening conversation for us all, I would say.
Thank you so much. Thank you for doing this. Thank you for building this temple. I really appreciate it.
Thank you so much. Thank you. So let's close the doors. I take my energy back, which is Typical. So, to our audience, thank you for watching this new episode from Let's Create a Healing Temple of the Cosmic Powerhouse. I hope you follow up and watch all the other episodes, as we have great stuff to come. A lot of brilliant solutions, how we can create a healthier, a better world, and a different kind of healthcare, where self-healing power and spirituality will be included in all of the processes. Thank you so much for being here.